It's the weekend, so we can't make appointments for you. But they want you within the next 6 months to follow up with cardiovascular. The phone number's here. You can call sometime next week and they'll know that you've been here.
I got a question already.
Okay.
The last we heard about that is starting next week.
Outpatient.
Gonna be an outpatient type thing, and the way they talk, maybe every 3 days,
Every 3 days, what?
she would come in.
Yeah, they
To check something.
check something.
That may be changed.
So
Cause he
this,
asked me where I live.
so there's one thing.
Okay.
It says comment, staff will mail/call patient for follow-up medication clinic appointments.
Okay.
So
it.
that's
that.
what they're
That
gonna
might be
have,
it.
so
Okay.
that's what's gonna happen.
Okay.
Alright,
Alright, so now we're gonna go over your medicines. There have been 1, 2, 3, 4, 5, 6 medications sent to the CVS Pharmacy, Main Street, Amherst. So you'll see that I've written them out and that when the next time they're due is next to them. So your Eliquis, this is your blood thinner, and that's not due till tonight. You didn't take it till like 9:30 at night anyway, so if you get it later, that's fine. Aspirin you take in the morning, and this is a baby aspirin. So these two are your blood thinners.
okay.
So were you always on blood thinners?
No, nothing other than blood pressure.
So blood thinners, some of the things you've got to watch out for, you know, you're going to bruise more easily. You're going to want to watch if you shave your legs. But also if you have dark stools, you start getting black stools, you need to call the doctor
Okay.
because it can cause some bleeding of the lining of the stomach. So your atorvastatin, that's Lipitor, that's to bring down your cholesterol. Have you ever been on a statin before? So the side effect, if anybody's going to complain about it, because I'm on Lipitor too, is that it makes your joints hurt. Makes you feel like you have the flu or something. Yeah, it makes your joints hurt. Just tell your doctor, because sometimes they can do some changes with when you get it and, you know, the
Okay.
dosing to help with that. Not everybody does that happen to,
Right.
but if it does happen to you, just know that if you're not coming down with the flu, it's probably your statin.
Okay.
So your Tessalon pearls, these are for a cough. Tessalon pearls are sort of like a numbing medicine down in so you might feel it in your throat, like if you've done that chloroseptic spray and it makes, so if you, that's the side effect of that, but it's perfectly normal. And it's 3 times a day as needed. Colchicine, so did they say you have gout?
She asked me, have I had gout? And I told her no.
So why did they put you on colchicine then? Well, it wasn't something you had done before, because that's an anti-inflammatory that they usually give people with that's on gout.
Well, they said there's inflammation when they looked in with the catheterization. So
Oh, okay. So that's what they're having. This is for
The
inflammation.
Inflammation, yeah.
Now this is another thing that can hurt your stomach. Always take that one with food. And then metoprolol, you're taking half a tab. So if you don't already have a pill cutter, it may come already half, but if you
Okay.
need to get a pill cutter, know that you may need that. This is metoprolol. This is for your heart rate. It also does blood pressure. But metoprolol can really get your heart rate down. So you need to stand slowly. And if you feel that you're getting dizzy a lot, check your heart rate. And if your pulse is less than 60 a lot or really low, and it can get it low, like 40, call your doctor, because then they'll have to adjust your dosage. This 12.5 is really low. You shouldn't have a problem, but just in case. Then you're taking ibuprofen every 8 hours. Was that something you were doing at home?
No. He said, well, one of them said that
Yeah, I'm getting.
They found
I
out
need
that
that.
ibuprofen was better than the aspirin for the
Inflammation.
for this inflammation.
Okay.
But that ibuprofen, I think is just for this.
Okay, just for your heart.
Right.
Okay. So they've got you on this medication thing that they're gonna see you every couple days. When they're gonna call you,
Yeah,
that
right,
your
yeah,
medication clinic.
That's what he told me.
So that you really need to go to that, cause you're on multiple blood thinners, you're now on multiple anti-inflammatories, and all of those things can cause bleeding in the stomach by themselves. So, and you're on all of those, so just be really careful
He said they wasn't as worried about that as the stroke.
as a stroke. Okay. So, vitamin D3, you were taking this, you
I
take
had
that
that.
in the morning.
Mhm.
This one, you're on Omeprazole, that's your stomach pill.
Right. Mhm.
This one becomes really important, especially now that you're on all of these different blood thinners. So you start taking that in the morning,
I do.
and take that religiously with all of your medications. 'Cause
That's
it's-
what
Yeah,
she's already
I take it.
Yes.
She's already taken.
and your
Oh yeah, that's
Vinla,
for anxiety.
yes,
I need that.
Fexaline,
I need
and
that.
that's tomorrow. And they're stopping your hydrochlorothiazide.
Okay, good.
So if you
That's what I was wondering.
If you have that, throw that out.
Because you had the half down here, and that's
Yes.
a blood pressure and a
And that
A
helps
heart.
you. Yes, that one makes you pee, and it's for blood pressure. Your
Uh-huh.
other one does blood pressure and your heart rate.
and your heart. Okay.
Okay. So, do you have any questions?
All
Now, you had come in for chest pain, right? Was it chest pain?
it was. I had a cough, and I thought the cough is what was causing a whole lot of discomfort up through here. I couldn't rest, couldn't do anything like that. That's what I came here for.
But then they catheterized you, right?
The EKG said I was having a
Heart attack. That's right. So, if you have those signs again, if you become sweaty, just you don't pass go, you don't collect $200, you just call 911
Okay.
because you do have some vessel disease. They had shown that there's, that's why you're on all these different blood thinners, and they're taking care of you medically.
Mm-hmm.
Do you know what I'm saying when I said vessel disease? Do you understand what that means?
That's
It's
the
like
little
40% blockage
Yes,
that they're
that's-
talking about.
The
So-
little tiny.
So your heart has its own vessel supply. So when we say you have vessel disease, some of those vessels are getting clogged up. And your heart is very intolerant of not getting the blood flow. It gets very cranky. So you need to, if you start getting chest pain, you just call 911. 911.
Okay, because they couldn't do stents.
That's right. That's why you're on all these medications.
Oh. Yeah, they said it treated with medication.
Yes, you're being medically managed.
They wouldn't do a stent in
Or a crook.
a vessel.
Yeah,
They just do stents like in the artery.
yeah.
The big thing, the
Yeah.
big tubes come
Yeah.
in. That's
Yeah.
where the stents go. Because he had mentioned that they had found a blockage in one of the vessels.
Yes.
One of the nurses, the nurse had drawn the little picture on the board.
Oh,
and
yeah, I got the
come in
diagram.
and, okay.
So that's how they're managing you, but that doesn't mean that you're still not at risk now of, they've got you on these blood thinners, that decreases the risk of what we call a clot forming on any of those you're atherosclerotic, so you've got, like, we all get these sort of calcium fatty builds up, and then sometimes a clot can form on that and completely block off. But that's why they have you on all these blood thinners. So, and anti-inflammatories, but that's why he was also concerned, we have you on all these blood thinners, so not only do we worry about your stomach and bleeding from your stomach, but he's worried about you bleeding in your head. So, what are signs of a stroke? Do you know what they are?
Yeah, slurred speech.
Droopy face.
I guess can't think straight or
That's right.
being able to.
I read something
Your
about
eyes.
ask a question, if you suspected, ask them a question. And doggone, I forgot, I seen it on the board here. It said,
I'll be able to raise your arm if you.
Yeah.
Raise your arm.
Raise your
One
arm.
thing I asked them to do.
So it's face, speech, their speech will come off, and sometimes it's not that it's slurred, it's they start going, they're going, fork, they're calling things weird, they know what it, but it cannot come out the right way. Those are signs, they're droop,
I've seen that,
Getting
the
numb.
face thing you're talking about.
Yes. Okay, so that's another 911. But they're gonna be watching your meds very closely, it seems.
Okay.
Okay?
Mhm.
Do you have any questions for me? I know
Just
this
watch
will-
for black stool.
Black stool, and if she suddenly starts drooling, speaking weird, can't move things, those,
don't
or
know
has chest pain.
Don't know who he is.
That's right.
Yeah.
Bad pain in the head.
All right, so do you need help
This
getting dressed?
was something that's coming on anyway, or
Yeah.